Hi, my name is Tiara. I'm here to talk to you about safety in the perioperative period. The perioperative period is time before you go to surgery, the time you are in surgery, and the time after surgery. We will be talking about ways that we as staff members will be keeping you safe, along with some other ways that you can help in keeping yourself safe. One of the first things you should know is you will receive a patient identification bracelet. This bracelet has your full name and date of birth. We will be asking you to verify your name and date of birth while looking at that bracelet. The second thing is you will get a full head to toe assessment done, which includes vital signs, skin assessment, checking your strength, mobility, and a few other things. We do this because we want a baseline, so if after surgery something were to change, we would catch it. We'll also be drawing labs. Labs are done so we can make sure that they are normal levels and that they are safe enough to go to surgery. One of the ways that you can help in keeping yourself safe is you will get an order for NPO, which means nothing by mouth. This means that the day of surgery, usually starting at midnight, you cannot eat or drink anything. This is done because we want to prevent aspiration. Aspiration is when food, water, or other things would get into your airways, and we don't want that, especially in surgery. Before you go to surgery, you will need to sign an informed consent. The surgeon will come talk to you about the procedure, and he will get your signature, and I, the nurse, will witness it. We do this to make sure that you agree to the surgery. So when you are transferred into the surgical wing, one of the first things that is done is we will again verify that you are the right patient. We will ask you to describe the surgery that is being done and the site that it is going to be done at. This is also a safety measure in place to make sure that we have the right patient, we're doing the right procedure, and have the right site. During the surgical process, we adhere to strict technique of making sure we are sterile and clean. All staff in the OR will have on surgical scrubs that are put on once they get to the hospital. So that is very safe. Along with if there is any break-in sterile technique, that is communicated right away to the team and everyone stops what they are doing. And we would then fix whatever needs to be done if it needs to be fixed, or we would just, if a glove needs to be changed, it would be changed to maintain your safety. Along with that, you will be positioned in a way where you will, hopefully it will be as comfortable as possible depending on the surgery, and to prevent mobility issues afterwards. After you have the surgery, you will be transferred to the post-anesthesia care unit. This is where we monitor you closely, watch your vital signs, making sure they are at good levels, and also check that you come out of the anesthesia okay. These are a few ways that we keep you safe, and before you're discharged, we will give you instructions. We'll give you a number to call if you have any questions or concerns. So if you have any questions about safety or anything else that you would like to implement to keep you safe, we would love to hear it, and I hope you enjoyed this video.